I am Dr. Carey. I am a pediatrician in Ventura, California, and we are talking baby care. Today I'd like to introduce my two guests who have joined me to share their child's experience with fever. This is Barbara, the mother of Ganar, an energetic little 2-year-old, and Yvonne, the mother of Harrison, who is 10 months old and about to become a handful. They start moving at that age. Welcome, everyone. It comes down to fever generally is really harmless, and we get concerned about a number, and we tend to wonder what's low, medium, high. I have my own little definition of 100 to 101 I consider low grade, 102 to 103 is medium, and 104 and above is high. Fever is generally not dangerous though, no matter how high it goes, and technically if a fever gets above 106, 107, it can be dangerous. But by then, most parents are running to the pediatrician anyway, so I tend not to be too concerned because I know they're going to seek the attention that they need. And then there were a couple of cooling methods that we talked about. We talked about giving medicine. We gave ibuprofen and acetaminophen, and then putting a cool rag on the head, and then bathing. Water to cool them down isn't so much putting them and submerging them in water, which is really not necessary all the time to help make them more comfortable and bring down the temperature, because the way cooling them with water works is when the water evaporates off our body, it helps to bring down the temperature. And you can actually use lukewarm or tepid water. It does not have to be cold water. In fact, they'll really be mad at you if you use cold water. When the water evaporates off our body, it comes down. In the old days, they used to rub people with rubbing alcohol, which is a really dangerous thing to do, which should not be done at all. But because it evaporates off the body fast, it really brought down the fever really quick. Certainly any child under 2 months of age, no matter what the temperature is, really needs to seek medical attention right away. And I had a mom bring in a child once who was just a few weeks old, and she was just really fussier than usual. And mom said there was no fever at home, but by the time we got to the office and checked the temperature, the baby was running a fever. So really, in little ones, since they don't have many ways of telling you how they are, you really have to go by how they're acting and what they're doing. And this mom was really astute in noticing that her child was just not, and it was her first child, but she said, no, something's not quite right here, and came into the pediatrician, and the child had fever and a serious infection, ended up going into the hospital but being okay, but needing to stay there for antibiotics for about 10 days. So there certainly are reasons why fever is concerning. What was your biggest concern with the fever for your child?
Just having the temperature go up too high, and just concerned on when to bring him in, exactly if I was doing things right. You read about the seizures also.
Mm-hmm. Febrile seizures they're scary things to see. In just about all instances, they're completely harmless. There's usually a family history. When you start poking around, you'll find someone down the road who had them. They tend to have their peak incidence between 6 months of age and 6 years of age. Children tend to outgrow them. Most of the children only have one. Sometimes they can have multiple. And almost never is medication for the seizure necessary for them. They usually last briefly. They're scary to watch. They go away. And in many instances, one doesn't even have to do further testing or blood work or anything for that child if it really looks like the fever itself is quite harmless. Once in a while, they become a little more significant, and the fevers can go on for quite a while, but that's not very typical. I would be concerned, again, for the little babies, if they're really crying and fussy and just seem out of whack. And that's really what I like to see, is the fever come down for a little while, they get perky, you're thinking everything is wonderful, the fever goes back up, and then it comes down, and it's sort of this up and down. Fever tends to go about 2, 3, maybe 4 days, but as long as they're having periods of perkiness, I think that's really good. I'd be concerned if there were other things going on, especially for girls, if they had diarrhea recently or there's no other source. One needs to be wondering about whether there's a urinary tract infection or something like that going on. Is there coughing or something to suggest that there's a pneumonia? Do they have cough and cold symptoms, which maybe would point to an ear infection? So you really have to take a look at the whole picture of what's happening with the child, not just the fever. Breathing, I think that you really need to look at the breathing. I don't know if you've ever noticed, do you know how your child's breathing was when the fever went up?
This last time, no, but when he's had a higher fever, almost not quite panting, but the breathing got a little faster.
Mm-hmm. How about you?
Yeah, I noticed his breathing was a little bit faster.
And when the fever goes up, the heart rate will go up, they will start breathing faster, and when the fever comes down, the breathing should get better. But if the breathing seems to be increasing or more labored, they really seem to be huffing and puffing, then I would be concerned. Sometimes I'll just have a parent take the shirt off of their child and take a look at the chest and see if it's caving in, see if the child is really working hard to breathe. If it's exhausting to watch your child breathe, then they probably should be seen to know what's going on. And the other item that's really important are fluids. And there's really no reason not to continue with bottle or breastfeeding or whatever your child is normally taking. Usually the solid foods they're not interested in, but I'm really much less concerned about the solid foods than I am the liquid, because when the fever goes up, we're really starting to burn a lot of energy, and we're starting to lose a lot of heat, and then we're losing a lot of liquid in there. And that's really a big thing to watch for with any of them. How many wet diapers are we having? Are they just as heavy? Are they getting lighter? And what's going on? So the takeaway really is the activity level of your child. How are they doing? Are they looking around? Are they interacting? When the fever comes down, do they perk up? Do they wonder what's going on? Or are they completely out of it all the time? That would be very worrisome. We talked about medications. One of the patterns which is used by some people, which I really am not a fan of, is alternating medications. I don't know if either of you have ever heard about that or
Heard of it, never done it.
Never done it.
Yeah.
Okay, it's because I probably said don't alternate medications. And the real concern is giving too much medication. Some people will give Tylenol or acetaminophen, and then they will give Advil and Motrin or ibuprofen, and they will do one every 4 hours and the other every 6 hours. And it's easy to make a mistake. It's easy to give too much. These are medications that can damage the liver, that can be really harmful, and one really needs to be careful about that. So if the fever is going on for too long, it's really important to see the pediatrician and see what's going on. Also look at your baby and see if there are funny rashes on your baby, because if there are, they probably need to be evaluated right away. And that's fever. I thank my guests for sharing their experiences with us. I'm Dr. Carey, and I thank you for watching. For more baby care education and to sign up for our free newsletter, please go to www.drcareys.com, where at Dr. Carey's we teach baby care.
Breathe in, breathe out. Breathe in, breathe out. Okay, let me see your ears.